What happens to type 1 diabetics if they eat nothing but fat?
If you look at the earliest diet that was given to type 1 diabetics before they started using insulin, it was almost entirely carnivore. You look at these old-fashioned prescriptions, it was this much fatty meat. Fat is a fuel that doesn't need insulin to tell it what to do. It can get into the cells of the body. The brain, which doesn't use fat, it readily uses ketones, which you'll make plenty of if you're burning a lot of fat. The great tragedy, when we discovered what was missing by giving these patients insulin, that changed things. Now these people could live a long, happy life, but it shifted the paradigm, which was eat whatever you want and cover it with your insulin. This is a term any parent who has a child with type 1 diabetes will have heard this. Asinine advice. This is a disease of not metabolizing glucose very well. All dietary carbohydrates are going to be converted to blood glucose to some degree or another. So the type 1 diabetic, what used to be a carnivore diet, basically became the same standard high carb diet. But you look at these poor kids with type 1 diabetes, it is a life of constant fluctuations, the constant anxiety. And yet now we know in human studies, what happens if you control the carbs, get them off the roller coaster? Sure enough,
it flattens.
It's a flat line, and their insulin dose just plummets.